Hi, my name is Barbara Fischler. Here's my ID, Dr. Reagan. Let's see. So I am a full-time student in the adult Gero primary care NP program, so entering my second year. I, have been practicing as a nurse for a few years, a couple decades actually. I'd say the bulk of my practice has been in the critical care area, mostly cardiac surgical. Did a little CCU in Hartford a little while back, and for the last 10 years I've been working in an ambulatory surgical orthopedic center. Also done a little bit of substitute work as a school nurse. That's a little different demographic there. My experience with research really is limited to back in the critical care days. We were doing participating in studies, research, data collection for a drug, protein that was being used to reduce. The goal was to see if it reduced the need for transfusions in the post-operative setting. It was kind of neat because I couldn't quite remember what the drug was, so I looked it up. And it was kind of relevant to this class because I learned that there was a lot of data supporting the drug, and then there was a couple studies of bad quality that came out around like 2006 that led to its withdrawal from the market. And then, that data was later reanalyzed, and some flaws in the studies were identified. And Canada actually reintroduced the drug because it was quite effective. But the impact of that poor data still hangs in the U.S., and the drug probably will not be reintroduced. So it's kind of interesting. Probably participated in some QI kind of initiatives then too. But working in the ambulatory surgical setting, with my interactions with patients are 60 to 90 minutes, and working per diem. Really not involved currently with any initiatives that were listed, evidence-based practice and nursing research, that kind of thing. I mean, certainly the care that we're providing, is based by evidence-based practice, but not really asking burning questions, that kind of thing, of my patient interactions, as was mentioned in our studies. For me, I would say my interest going into this semester is really in identifying effective interventions to aid adults in initiating some lifestyle modifications, make healthy diet and exercise choices to promote their overall wellness. This past spring, during our first semester of clinical practicum, working in the primary care setting, I would say just the majority of the patient encounters I had, I worked with patients that were suffering from complications of obesity, and many of them expressed, frustration at achieving success with lifestyle modifications. So I'm just kind of curious, what methods are, the most effective, or if that has been, looked at in the research. So I guess that's about it. And thank you very much.